wanted it just.
Shall we call the meeting to order?
Yes, it is 4:03 p.m. Director Perezio.
Here.
Director Shore.
Here.
Director Delara.
Here.
Director Lofton is not with us. Secretary Barraza.
Here.
Vice President Rodriguez.
Here.
And President Rodgers.
Here. Please join me with the pledge of the flag. Ready, begin.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next on the agenda is approval of the agenda. Are there any changes, additions?
Second.
Never moved and approved.
Thank you.
No choice there. All in favor, please say aye.
Aye.
Opposed, motion carried. At this time, comment from the audience may be made on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. The board has a policy of limiting speakers to no more than 3 minutes. The board cannot take action on items not listed on the agenda. Public input may be offered on agenda items when they come up for discussion and/or action. Is there any public comment?
Any public comment for items not listed on the agenda? None at this time.
Hearing none, let's move on to consent agenda. We have on the consent agenda 1, 2, 3, 4 items. Anybody want to discuss any of the policies that that was something that we had presented for discussion?
I'll move approval of the consent agenda.
I'll second.
All right. Roll call.
Director Shore.
Yes.
Director Perezio.
Yes.
Director Delara.
Yes.
Secretary Barraza.
Yes.
Vice President Rodriguez.
Yes.
And President Rodgers.
Yes.
President Rogers, should we, before the vote, ask if there's any public comment?
Thank you. Is there any public comment on consent agenda?
There are none.
Hearing none, we'll move on to presentation, which is our 2025 audit report. We have a representative from Moss, Levy, and Hartsheim.
Terry Robertson is with us from the CPA firm that has performed the district, foundation, and retirement protection plan audits. And so this is our annual presentation to the board and to the public of the outcomes of the audit report. So turn it over to you, Terry.
Thank you. Okay, so we performed 3 engagements. So I would like to start with the management report.
Thank you.
I'd like to start with the management report on page 139 of the agenda.
And what we're going to do here is go through all of the audit reports, and then we will vote on the district ones, the district and the RPP, and then later on the foundation meeting that will do the official vote then. Yes.
That should be, yes, that should be it. Okay, so basically the management report basically exists to inform the board what we've found overall on the audits. It's not so much the audit report, but it'll let you know if there's any issues we found, such as whether there's any problems with internal control, which in this case, there were none. It also updates you basically on any new accounting procedures. In this case, the Government Accounting Standards Board implemented a new GASB 101, which related to your compensated absences. So there was a slight change to your financial statements. Basically, some additional liabilities show up only for financial statement purposes. Has no impact on cash flow. It doesn't impact when people claim their vacation or sick time. It just basically exists as the date of the financial statements because, well, that's what the board said we have to do. So basically, we've gone through all three audits. It's one management report for all three. And there's, the audit was pretty standard, no findings. And of course, there's nothing really else to report there as a general rule. If there's issues, there's usually a lot more in there. Or if there was journal entries over a certain dollar amount, we'd include those, but none of those occurred in these audits. So the next thing I'd like to discuss would be the Desert Healthcare. I believe the audit opinion for that is on page 150. So for each of the three reports we did, we give a separate audit report, basically where we say whether or not you're in compliance with the accounting rules. In this case, you have the clean report, meaning it's the highest you can get. Since there was no exceptions to the accounting rules, basically, we say you're good, you're in compliance with those. And that's pretty much all that report's useful for. I mean, we can go over more in depth, but honestly, only people like me care. If you want to move on to page 154, that should be your MDA. And it gives a nice summary of the financial statements for the Desert Healthcare. So basically, your activity is pretty similar overall. This year, your cash did go up by about $7 million. Basically, that's a result of your actual activities. You guys had a pretty good year taking in cash, and your net position went up slightly more than that. Your payables basically stayed the same. And so basically, that's it stays pretty much consistent across. Your lease receivables went up about $800,000, and that's a result of the way the calculation works. You had a couple of new lease entities come in, and when that happens, you record basically the entire lease value right up front, and then it just decreases over the life of these receivables. I wasn't really going to go any further in depth in the details unless you guys wanted to ask some questions or wanted to see like the income statement, anything like that.
I had a question.
Mhm.
I noticed that the Desert Regional Medical Center or Desert Care Network financial statement included some changes in it because of the change in the terms of the lease purchase agreement. And I'm wondering if that has any impact on our financials, how we report it.
Slightly, because it hasn't quite happened yet. For the most part, the activity doesn't yet show up on your financial statements. The building you're referring to, you don't actually technically shows up on your financial statements because way back when it started under a different rule, once you basically did this lease, it was treated as sold. So the assets aren't on your books, nor any kind of liabilities. The latest accounting rules regarding leases relates to the entity that basically leases the hospital, also leases a couple of rooms from Desert Healthcare. In the previous years, those were not included in your lease receivables for basically a technical reason. No one was quite sure if they were going to exercise their option to keep going or not. So basically, those weren't on there. They were just shown as income in the year you got paid. This past year, there was a slight change where they basically went in your lease receivables. It wasn't a lot of money. I forget how much, but basically your overall lease, the 200 million, whatever it was, you won't actually see that on your financial statements until you basically, not only is it implemented, you'll basically report that on a payment schedule. It's possible when it's complete findings, you start getting payments, if they've made some new interpretations of the rules that might change slightly, but we don't anticipate any large changes to your financial statements. It's basically when the cash comes in, you recognize it because you have nothing, you don't really have anything to give up on your books at the moment. So you basically have revenue and then you just dump it in cash.
My next question,
Go ahead.
okay, my next question is, are there any anticipated changes in legislation or executive orders or whatever that may have an impact on our future audit?
Well, for executive orders, your guess is as good as mine. We don't really anticipate anything, particularly for your level. You don't really have any federal dollars. I mean, it is possible because related to the hospital, but this entity doesn't really get dollar amount. So it's possible if enough change happens to reimbursement rates, obviously, the company that's basically leasing to own it could have some issues. I sincerely doubt it's gonna rise to that level, but unfortunately, there's basically a crystal ball at this point. As for any other kind of legislation, I haven't heard anything that would specifically impact you, and there's no pending accounting items, which isn't quite legislation, but for what I do, it counts just as much for us, so that would impact your financial statements in any real manner.
And do you have any suggestions for changes in the way that we conduct our financial business within the district for our future audit?
No, we didn't really have any recommendations. Your operation is pretty well run. I mean, you're a very small shop, so it's not ideal, but your controls are pretty good. Your accounting methodology, the way you estimate things, they all seem to be flowing perfectly. We had no concerns with any kind of operational issues or anything like that. So as I said earlier, we didn't have any findings, nor did we generate any recommendations.
Okay, thank you. Director Shore?
Is the $555,000 net negative in capital assets, is that just normal wear and tear and the site and the schedule of depreciation expressed?
Pretty much depreciation.
Nothing out of the ordinary?
No, there was nothing out of it. Pretty much depreciation. Somebody left, you junked what was in there. And then you recognize improvements when the new entity comes in. So I think there was a little items written off, but they were basically fully depreciated.
Okay, thank you.
So being a public entity, we are expected to have a lot more accountability. So can you assess in terms of segregation of duties, the policies that we have to ensure that the public, that the recording and all of the accounting systems are in place, that they are strong? Is that, can you tell us if that's the case, or if there's, just in terms of how you would assess our systems?
They're decent.
Decent?
Basically, as part of our, well,
I want stronger than decent.
well, unfortunately, the nature of our business is we don't really proclaim that your procedures are good. Would we recommend any improvements? No, we didn't see anything that really needs to be improved. Yes, you're a pretty small shop, but you recently hired a third person. So you split up some of your duties since previous audits. So from our perspective, you've got a pretty good internal control for the size of your staff. Could you split it out more? Yeah. Is it worth you spending more money? Probably not.
Thank you.
And one of the things, if I may, that we added a few years ago was adding the component where the board members are signatures on the checks and that. So we're allowing that as like a additional piece to our internal controls component. So it's not always, just the internal staff that are responsible for all of like the payables and things like that. So our board members then are seeing those as a part of the additional controls.
And that's 2 board members per check.
Over $5,000.
Yeah.
Yes, that was part of your internal controls as we assessed them. Yeah. That is part of the reason why we're deeming them with no addition. If you guys weren't looking at it, we would probably have suggested that stack. For all I know, my boss, since this is my first year on this hearing, for all I know, my boss did suggest that a couple of years ago, but we didn't discuss it. Mm-hmm.
Any more questions? Any more comments? Any comments from the community? Any questions? Thank you, sir.
And
No, one more.
that's for the healthcare district. So we still have the retirement protection plan as well as the foundation.
Yeah, so
Gonna go
it'll probably be a little bit faster. The foundation is on page 162. Essentially, that's the dollar amounts, but I'll start with the opinion since it's basically, it's a clean opinion and there's nothing really on on the audit report that you're going to see, that's the same as it does at healthcare. It's the strongest opinion yet. We had no findings. Not too surprising, given it uses the same internal controls. Your activity was pretty much the same. The only thing that really went up this year was your grants receivable, which is a reflection of basically long-term grants that you as the board approved for the foundation to receive from the district, but they don't get paid until they're ready to pay the recipients, and they're for multiple years. And then that's basically it. Everything else pretty much stayed the same. Your investments went up a little bit. Everything is pretty comparable. That's the only thing that went down was your cash, because you paid out some of you don't basically move cash over as you expect to pay your grants, which is your primary expenditure. So you weren't expecting to pay out too much within the next few months of June, so you kept it basically to what you need for your operating purpose. You know, when you pay your payroll, things like that. Does anyone have any question on the foundation? Okay. Basically for the RPP, that's basically your dissolved, not dissolved, but no longer any employees, so there's no participation in the plan. Basically, that has the same deal. That would have, not sure. In any case, I was just going to mention that I had a clean opinion. Like everything else, basically that comes back from, it's an actuarial report. Basically, you pay in enough to pay what the actuary says you need to keep the plan going. You're probably a little overfunded at the moment, but given the fact that you have not, it's kind of tough to say how much money you're going to need. You don't usually need to pay into it. So you have something like $1.5 million.
We may want to go a little bit further.
Here we go. Okay, so for the income statement, sorry, I must be off a little bit. As you can see, basically, it's about $500,000 in income. That's reflective pretty much only of your investments, and basically where you pay certain expenses, like us, the management of the plan, sales, and whatever administrative expenses. So you paid about $250,000 in benefits, and that's a result of basically your former employees aging out plan, shall we say. So eventually the plan will come down. You won't need to keep track of it at some point. And then whatever's left over asset wise, if there's any in the investments, you'll basically get that back.
I have one thing to that, because you had mentioned about $1.5 million, that we did have the net pension liability. In this case, it's an asset because we're overfunded in the plan. Did go from 1.7 million last year to 2.1 million for this year. So we did have an increase on that, and it's been increasing the last couple of years.
Okay, so that's what I think. Basically, that represents what you're supposed to have left over if all the estimates are the same. You know, meaning they're right. They won't be right, but it's probably a pretty good ballpark estimate, because there's not a lot of people left in this plan. So you're not talking 30 or 40 years for most of these people anymore. Where you have no idea what your results will be. Like CalPERS takes their best guess, but given the sheer number of employees they have, and you're talking 30, 40, 50, 60 years, those numbers have wild swings. Yours should stay pretty steady over the next few years, assuming no huge market issues.
Yeah. So essentially what that $2.1 million net pension asset is that if we were to pay out today all the participant funds that are in the plan, we would have $2.1 million roughly left over that could come back into our district operation. So just from a summary level, that's what you're looking at. And it used to be years ago that we had the flip of that until we did put some monies into that investment account that made us 100% even. But then over time, as the investments have improved, and then the distributions to participants as they've left employment of the hospital and taken their resources out, we've been benefited by that growing over time. So,
do we have an estimated number of employees that are?
You do. Unfortunately, I don't know off the top of my head. I mean, there's a report that gives it because we look at it. But I'll be honest, it's something we spend, a number of employees, we just look to make sure it seems pretty reasonable.
Yeah, I get that number in our meeting this morning.
Yeah.
I think it's roughly around 50 that are actually still active there. I think it's under 50 that are active
47.
employees. And then there's roughly 50 or more that have left employment, but have not requested the distribution. So is it roughly 100 that we
Yeah,
still have?
As
that
of the end of
participate
September was
funds?
101 that we had total active
And have we looked, done an actuarial report in terms of age and life expectancy and?
Well,
Yes.
yes,
How
that's,
long do we
that,
keep this out?
that is basically the sum total of the vast majority of our audit work on the RPP. There's a few other things we do, but we basically get that actual report, review the estimates, we look at the number of people. We check out some data, make sure that, nothing weird has happened to the estimated age dates. We look at the reasonableness of the expected growth of the investments, and that's basically how we decide. But basically, the actual calculation is done by an actuary, and then where our work is somewhat verifying what we don't recalculate it, but we do check to make sure what they did is in accordance with, well, basically actuarial and accounting.
Yeah, so we actually have an actuarial firm that we engage with annually in conduction or along with the annual audit. So we do have that independent look from an actuarial firm that determines the numbers that go into this audit report.
We do have a 100% mortality rate in this country.
Everywhere as far as I know.
How do we know that?
Death and taxes.
And that's pretty much all I have. I'm not sure if you guys have any more questions or,
Thank you.
well, thank you.
Is this an action item?
For the district and the retirement protection plan, the foundation will be action under the foundation
Just to
meeting.
accept the
But
report.
he just reviewed all three of them here in this.
So just to accept the report.
Yeah, so it'd be an action to accept the audit reports as submitted for both the healthcare district and the retirement protection plan.
So I'll move to accept the report of the healthcare district and the retirement. protection.
Second.
Seconded by Director Shore. Roll call, please.
Director Shore.
Yes.
Any comments?
Public.
Excuse me, any public comments? Hearing none, roll call, please.
Director Shore.
Here.
Director Forestkil.
Yes.
Director Delara.
Yes,
Secretary Baraza. Yes. Vice President Rodriguez.
Yes.
President Rodrick.
Yes. On to strategic grant funding.
If I may, I just wanted to thank the staff and all the hard work that goes into this each year to be able to have the confidence in presenting to you a unmodified audit reports each year. And I think that's crucial, especially to a public agency, to be able to have that reliability and confidence in the work that your staff does for the organization. Thank you, directors, for your support and all that goes into this. I mean, I'll credit all the staff, but obviously our accounting staff, as well as Erica on the grants team side of things that, she's our eagle eye on our grants and ensuring that we have compliance there from financial perspectives, et cetera. So I appreciate the staff and the work that we do.
Thank you.
Thank you. Okay, on to strategic grant funding, grant number 1504, Regents of the University of California at Riverside. Sarah, start out.
Thank you. This is a grant for $192,156. Point out that the program committee, for the program committee, and they moved approval to move this forward to the board. Y'all hear me? And the use of funds is basically through a mentorship program in medical students, program director and program coordinator to structured mentorship for medical students rotation through the Eisenhower's emergency room. And I wanted to also point out, it was brought up by Director Baraza and asked if there was any conflict with Eisenhower Health, and no funds will be going to Eisenhower Health. Dr. Ann Cheney, I believe, is with us if you have any questions. Otherwise, like I said, the program committee did move approval to move this forward to the board.
I do have a comment. I noticed that the comments that the reviewers had about the sustainability of the program was brought up. And I don't think there is a solution for that right now in the foreseeable future. So I just wanted to comment on that, acknowledging that the funding that we're providing is necessary for this to be provided. And that even though that was a concern, that I appreciate the fact that it was brought up, but it's something that we need to do. So that was it. And I'll move approval.
I'll second.
Public comment?
No public comment.
Roll call, please.
Director Shore,
Yes.
Director Perezco,
Yes.
Director Delara,
Yes.
Secretary Barraza, Vice President Rodriguez.
Yes.
President Rogers.
Yes. Okay, grant 1518, Riverside Latino Commission on Alcohol and Drug Abuse.
This is another grant that was in front of the program committee. We moved approval to move to the board for approval. 1.2 million plus is going to help place therapists in the Coachella Valley Unified School District. As you probably know, through Coachella Valley Unified School District, they had some rather large cuts and took out a huge chunk of the necessary behavioral health support and resources that Latino Commission provides to the students and their families. So this is for 1 year, and again, program committee did recommend approval on this. We do have 2 representatives from Latino Commission that are here. If anybody has any questions. Any questions?
My question is this an extension of has this grant been, have we approved this kind of grant before with this organization?
We've approved previous grants with the Riverside County Latino Commission, but not this particular project.
Any comment?
I have a comment. Okay, my comment is that what Donna just said about the cuts and funding to the Coachella Valley Unified School District, these services are so important to our youth. And I'm so glad that we have such a well-respected organization with a strong track record that is stepping up to do this. So I'm really pleased that we can support what is needed. It's better to be preventative than have to deal with our youth growing up without the services they need. So I'm really.
Can I just add on that, as in recent studies have shown that in the Eastern Coachella Valley, specifically in that school district, there are high rates of suicide, as well as substance use issues. So completely agree with Director Delara, and the Latino Foundation probably is the best people to actually administer this program.
So how did you want to add anything, or, I mean, he's right about the high statistics we got in that healthcare services, so
Please come to the podium.
greatly needed. That makes it happen.
Good afternoon. Yeah, I just wanted to add, as I was reviewing the scoring that we received from our reviewers, I noticed the sustainability portion of it being kind of low. And we were discussing with Leonela and Alejandra about it. And we already came out with a plan. We just didn't have that plan when we applied, but we have a plan now. We're currently working on expanding our Systems of Care program, which is our medical program. And at the same time, we're working in expanding services for private insurances. That way, you know, for next year, if the funding is not available through CUSD, then we will be able to cover through private insurances and medical funding as well.
Can I ask on that too? Have you had conversations with RUHS Behavioral Health, the county's behavioral health, about a type of partnership or?
Yeah, we currently have a large partnership with, for many years with RUHS. We have a mental health clinic that is fully supported through Riverside County.
I would just continue those conversations for say sustainability. So.
Well, Latino Commission is also going to be helping with Kelly Grotsky and her group to see if they can come into
Perfect.
the health.
Okay, perfect.
because they're trying to get that MOU with,
Kelly's the one to talk to.
that's all of us.
I'll move approval.
I'll second.
Thank you, Sahal. I'm glad you knew that you have a sustainability plan. That's
Thank
great.
you, Madam.
Thank you.
Any public comment? Roll call, please.
Director Perezkiel,
Yes.
Director Shore,
Yeah,
Director Delara,
Yes.
Secretary Baraza, Vice President Rodriguez,
Yes.
President Rogers.
Yes. Reports, Michael DeCaro, CEO Desert Region Medical Center, report. CEO.
Good afternoon, everybody. So the full report is in your packet. Few things to share with you. We had some nice positive surveys come through the hospital this past month. We've retained our comprehensive stroke center status. We had, through this survey, we do this annually. We are the only comprehensive stroke center in the Coachella Valley. We had a lot of best practices that were identified from our surveyors. And one thing I wanted to highlight, they were very impressed by the outreach that our stroke coordinator, Kendall Zarevny, did in terms of looking at the demographics of our patients, where our patients come from, and those that needed more education around timeliness of stroke response. And what she found in specific zip codes where there was a larger delay before patients would come to receive care, it was predominantly Spanish speaking in these areas. And so we worked with the bus line to actually put in Spanish advertising on the buses that you need to understand signs and symptoms of stroke, really targeting the areas where we saw the longest delays. And the surveyors came in and thought it was really wonderful. And it was something that they wanted to share with all of the other sites that they were going to be surveying coming up. So that and other things they identified as best practice, which was really outstanding. I think just another feather in the cap of a tremendous program. And just as a reminder, we provide these higher level stroke services for the entirety of the Coachella Valley, beyond the Mexican border, beyond the Arizona border. We have patients that come from a very large distance that rely on us for their higher level of care. And I think it's really something to be proud of, and we certainly are.
Mike, can I just make a comment?
Yes.
A little institutional knowledge here. We gave grants way in the past to Dr. Siddiqui and his group at the time that with neurointensive and neurosurgical that helped build up where he was able to get you guys the comprehensive stroke center. So lost to our board that voted for that one, but on the grants, just want to let you know.
Thank you to the board for that.
Yeah, we had a hand in helping that.
Wonderful. We are very thankful. So are our patients. We had a great CAP survey. That's the survey that looks at our lab. Since the time that I've been here, we had the lowest number of findings that we've had in over a decade. Really tremendous work by the lab and just low level type things that were found. So great care provided by the lab under the leadership of Dr. Jolene Abrahams, our pathologist. Our parent organization is doing a lot for the Affordable Care Act enrollment initiative. So really trying to get ahead of where there may be some difficulties with re-enrollment for folks. We have a lot of education and outreach that's going out, and Linda Evans and team are working on many community events where we're able to spread the word about sharing where we're in network and advice to folks that may need to continue to have their coverage. So we're really looking at this through awareness education, key partnerships, and supportive enrollment. So we're trying to get ahead of this to make sure folks maintain access.
Mike, can I ask a question on that?
Yes.
It may go to Linda, but as you know, the work requirements that are being required, are you working on communicating what those are? Because it's not just work, but it's actually volunteer time. And so just wondering if you're considering that piece as well.
Yeah, that's fair. Do you want to comment on that?
Sure, we've got certified application counselors, similar to when we did the AACA collectively with the district and many others on the Medicaid side, that will be working with Covered California navigators as well to help educate people on those components, because there's a lot of nuances and
A lot.
yes.
And you can qualify on a lot of different things under that.
Correct, correct. And some will be eligible, some won't be. But I will say that if there are navigators and organizations that are affiliated here with the healthcare district, we would like to know and partner with them because we're gonna have this overflow. We're sending out a lot of information and our team won't be able to handle everything. And then we're wanting to be able to refer people to other groups and entities like we did with some of the other
So
nonprofits.
I'm wondering as a direction to staff, sorry to create more work. But if that's something maybe, I don't know, working in conjunction with whoever is to develop some type, I'm looking at you, Alejandro, specifically as the guru of collaboratives, of developing some type of collaborative in that measure. I know the county would play a role in that as well, so not to lay it all on you.
All you can fall back on from when.
Right.
From COVID,
We did the ACA.
the ACA, when we rolled out ACA, exactly.
I'd be happy to follow the partnership with California. talk through it.
Yeah, again, I'm sorry to create more work. And it's like, but again, it's like we already have the model. And again, and I know that I can reach out to RUHS
Sure.
as well to do that because you all know I chair the board in CHCs for the county, and that's a big concern of ours too, especially around the nuances
Yes.
of the legislation. So, and of course, we still have no direction whatsoever on in the.
Correct.
Exactly, yeah.
Sorry, I
Sorry, no, it's important work and we appreciate the support. We would love to collaborate. Absolutely. October breast cancer.
And
Yes.
I did hand this out to board directors, your flyer.
Okay, great.
And with the hope that the district can come up with some broad Coachella Valley-wide program that would support these efforts.
Thank you, Carol. Wonderful.
And we have that English and Spanish, by the way, so make sure.
October Breast Cancer Awareness Month. As always, we do our Mammal Mondays. We've had record numbers again this year through this point. So we're eager to get our total number of mammals that we've done through Mammals Mondays. This spills into November due to popular demand. So we're excited to offer that. And then I'll just skip down to our capital construction projects. We are finally done with our OR construction, which has taken a very long time. So all of our ORs have been completely renovated at this point. That's the 9 in our main OR. We are now moving to the 2 ORs that are in our OB unit. So those would be for C-sections. So really excited to have that done, and the other stuff is ongoing. I'll take any questions.
I want to make a comment, Mike, on the governing board meetings and the direction that you've taken them in, and this is no slam on Michelle whatsoever. But I love the presentations that you're giving us, and a lot more interaction. I'm sure you probably agree. So I just want to applaud you for the work that you've done with.
Thank you.
Reports. So
Thank you.
Any other comments? Any comments from the community? Thank you, Mike.
Great.
Okay,
If I may,
go ahead.
not for you, but you're done, Mike. All right. I just wanted to ask, I know, and I completely am in favor of it, but I just want to ensure that we're having a direction from the full board, not just one director, about assisting with this process.
So why don't I touch base with I've already written notes on to talk to RUHS and stuff. Why don't I offline with Alejandro and then maybe come back next meeting with a clearer direction, if that helps?
That's fine if that's, yeah. Just want to make sure that it's the consensus. that
And I think that this would play right into our long-range planning process.
So, Madam Chair, I think what you're seeking is to ensure that there's consensus for the full board, and I am in favor of it. And Director Barraza is in favor, Director Perez is in favor. So there is consensus.
Great.
Well, I'll take the role then as a board member to work with Alejandro to help do this, so that's not completely on his shoulder, so.
Teamwork.
Absolutely.
Okay.
Thank you.
Any other, like another person or whatever, we're open for that too, right?
Yep.
We have my report for Desert Regional Medical Center Governing Board report is in your packet. I just wanted to point out that there's always a rigorous discussion about quality of care during these meetings. And for those of you who want to look at how other hospitals in this community and outside the community, even Los Angeles. I gave you a link that you can click on. You type in the name of the facility and you can see all of the dirty laundry that is there. And I would say that our hospital ranks among one of the best. Any questions? Go ahead.
I just want to say you do a very thorough report, so thank you for that.
You don't like mine?
She'll compliment yours.
Any comments from the community? Hearing none, let's go on to Desert Healthcare District CEO report. Chris?
Great, thank you, President Rogers. So the first item is just an update on the Palo Verde Healthcare District situation. First item, bankruptcy. The healthcare district there did file their Chapter 9 bankruptcy on September 30th. There was a debtor's motion for order setting case status conference on October 8th that was held at the Riverside U.S. Bankruptcy Court. And so there was some discussion there, and the continued status conference hearing is continued to December 3rd. So one thing we'll learn from that is that the parallel that we're doing with LAFCO and also the working group that's been developed with LAFCO and other organizations, IHP, Healthcare District, RUHS, organizations, neighboring hospitals in Palo Verde area, that we're continuing the work to try to help identify providing supplies, et cetera, to the hospital there. There's the last communication from a few days back was that they had 10 days of operating cash. That can ebb and flow and can drop off at any time too. So it's a very, very risky situation that they are in. LAFCO is pursuing with the dissolution process of the healthcare district there. And so LAFCO was given direction to the first process that they have to establish with the dissolution is that they have to establish a zero sphere of influence for that area. And that would signify the intention to dissolve the district. And then that would be followed by conducting public hearings. Then there would need to be a resolution of intention to dissolve the healthcare district, and that must be adopted by the commission. And so those are anticipated to be completed and brought back to the LAFCO commission meeting on December 5th. And recognizing that the bankruptcy kind of prevails in a sense. So LAFCO and the working group are working parallel to that process, but the dissolution may or may not occur depending on what happens with the bankruptcy. So I hope I've explained that, summarized that well enough. If there's any questions, happy to address.
Just add a couple of things is the county has done an advance of property tax dollars.
Oh, thank you.
It's not a lot of money at all, 157,000.
181,000.
Yeah, exactly. But and then we've actually RUHS leadership, like the director of RER department, has been out there. And the supply thing is a real issue. And it's from an update I got this morning, it's like even staff within the hospital are not all on the same page of what they need. And so working really closely with the FQs out there to get the supplies. So, but it's a nightmare.
And the neighboring hospital in Arizona, La Paz, I think that's what it's called.
Yeah.
Is being very supportive there as well. And they're checking on the hospital, seeing what kind of supplies or support that they can provide as well. One other, thank you for adding that about the advance on the property taxes, Director Rodriguez. The other thing that I wanted to point out is that there's a WARN notice, which is a worker adjustment and retraining notification. Act notice that has also been filed with the state that indicates that the hospital intends to close by December 23rd, and that includes an expected date of layoffs for all staff by November 23rd, unless there's something that can keep that going. So
And by law, we have to file that warn notice, or they have to file that warn notice.
like a 60-day notice.
Yeah, but our workforce department is working with the employees on either relocation or whatever aspects as well. But so, knock on whatever the fate of the business is, that they just by law, they have to submit that, so they could, even if they still maintain operations.
Is anybody making plans for the care of the patients out in that live area in terms of emergencies?
So the working group that
Primary
Chris is
care.
part of, Dan Barnhart, our emergency management director, is part of that, and so there are.
Director Laura is
Well,
on.
yeah,
Oh, you're on the, I'm sorry.
No, go ahead. A lot of the principles of the county.
Yeah.
So
And
go
so
ahead.
they're looking at contingency plans, whether that's helicopter transports. We're trying to see what kind of care the FQs can give, but when you're talking about acute care, they can't give it. They don't operate 24/7. So those discussions are being had. There's no real solution per se. And I think that's the frustrating thing. And again, as we get so much, there's not a lot of cooperation from some individuals. And then when you don't know the financial situation from day to day, because to Chris's point, it changes. And one day we got 18 days, one day we got 3 days, and then it changes that much. So, but those conversations are happening. That's our biggest concern as far as speaking on the county side. But I think even on the healthcare district side, is the biggest concern is the care of the patients.
Well, and part of the challenge, and I think you alluded to it, Director Roger Rodriguez, is that even the healthcare district directors are not being very cooperative in this process. And so that even adds to me a different level of complexity when there's not a support. Because they're almost, at least from what I'm perceiving, is they're kind of pushing back on things a little bit because they want they're looking to the bankruptcy to protect them and keep the hospital going. And that may or may not happen. So I think the working group is really good. I think challenge to your point, President Rogers, is, what's going to happen to keep the emergency and that very urgent care to those people. And, I know the legislator process is over with for the year, but I mean, something that, to continue with our legislators and, identifying how to keep emergency services in these rural areas. And even if there's some way to be able to keep, the emergency department operating there for a longer period of time somehow until something else can come into play. But I think it was you that mentioned last month, Director Shore, that once a hospital closes, it's not very easy to reopen. So, but I think it's in, pretty dire straits as far as keeping it open.
What is your perspective, Jeff? What do you think? What is the bankruptcy going to help with anything?
I think, like I mentioned in the last meeting, once the bankruptcy is filed, there's an automatic stay that comes into play. And it's like, I like to analogize it to this giant bell that falls down and protects the agency from any creditors. And that includes, you can go through, LAFCO can make recommendations and go through everything, but unless it goes through the bankruptcy court and it's approved by the bankruptcy judge, you're just basically spinning wheels. And it's so hard, particularly with an uncooperative agency, to try to even help them. And I just think it's a really tough challenge. And things will get sorted out eventually, but what will be left is very doubtful that there's anything meaningful at that hospital, so. You know.
Madam President.
Ready and then-
Oh, okay. What I'm afraid of is that there'll be some opportunities that are not taken advantage of. In one of the meetings that I participated in, there was a mention of some funding from, I believe it was a state, Chris, that there was a need to actually put in some money and be able to get a greater amount back. And that would, so that was what I was hoping that with the county was moving in the direction of actually taking over some administrative role where there is that possibility to submit the application and being able to receive that funding, because $200,000 is not going to go very far. And so they need to have a higher amount of money to be able to operate the services. And we've already discussed the fact that we feel that there is a need to look out for the residents there and that the impact it has on our healthcare system here. And if there's a way that we could provide some funding to them, if it's a loan or some arrangement that we could do that would allow them to have more resources. And if that opportunity is lost because we're just kind of waiting and waiting and waiting, that would be unfortunate. So
Well,
I hope.
Yeah, what you're describing, Director Laura, is what they call an intergovernmental transfer program. And it's used by public hospitals to help maximize healthcare for underserved and Medi-Cal and Medicaid patients. And it's a really great program. And it should be maximized. But it would probably be better if it was funded by the city of Blythe, or even the county could transfer some money to do that. But it's a bit of it has a timing issue that you have to apply for at certain times. And frankly, those deadlines are you have to have the cooperation of the public agency to do that. And it would be difficult. We can't simply write a check and have that effectuate that way. It's just not feasible at this point. I mean, in the future, there's things that we could look at because it is out of district. And so we have to be conscious as directors that you're, providing the services for your communities. But, there are some programs of maybe some clinics in the future that could potentially have some help in funding to help that, at least to stabilize some of the patients in FQHC or something like that. But then again, it gets a little bit complicated. And what I always ask for at our meetings is trying to get some documentation, from the hospital and from the area hospitals on the impacts that those patients that are not being treated there now are going to have on this community. And if we can demonstrate a fair amount of impact, then that's going to go a long ways for this district to be able to help do some provide some financial help to that area.
So thank you. That program is the one that I was remembering that in early conversations that was being brought up as a potential solution by the healthcare district, the Palo Verde Healthcare District. And it seems like we may have lost that opportunity to be able to access those funds, which is very, very unfortunate because they were hoping to be able to do that and they just could not come up with the money. The city of Blythe has been in financial problems for many, many years. They're not going to be able to come up with $1 million or $2 million. And the county, I know that they were looking at how could they support it, and their answer has been to advance them $200,000 of their property taxes. So it's just very unfortunate that we couldn't come up with something more substantial that we could have actually made more of a strong effort to be able to access those dollars. That's what that hospital needed. And I'm very disappointed that those talks that we started having, 2 months ago haven't led to that point. But thank you for telling me that.
Yeah, and the benefit of that IGT program is that 200,000 turns into 400,000, or 400,000 turns into 800,000. So
2 million could have come up to 6.
4 million, and it really does, and they, most likely qualify for that, but it does take work to make sure that you respond to all documentation that's needed.
Thank you, Jeff.
So would that have been something that we could have, our district could have put money towards that to benefit that?
Probably,
Matching fund?
we would have to look at it creatively, okay, and probably through cooperation with the county. But, that it's, with that, those are the discussions we would need to have. But I think it would problematic, a direct payment would be problematic.
Yeah, not to them,
Yeah.
to the county.
Yeah.
Yeah, 1 second, Art. I know that Director Barraza said she had to leave at 5. Do you have any departing comments that you'd like to make before you leave? Is there anything on the agenda you feel strongly about that you have to make a statement?
No, thank you.
Oh, good. Art, you're next.
As a matter of historical context, this is not a new problem. How far back in time could you identify, or was a strategic analysis of the hospital done from the perspective of preparing an RFP to the entrepreneurial community of subset of the healthcare world? In other words, there's a whole host of companies out there, most of them fail. And every now and then, one of them really succeeds in surviving and thriving in an environment that looks like it's not possible for that to happen. Has the board of this hospital ever engaged in a critical analysis of what it would take to bring in that kind of an organization? Has that ever been done?
Well, I can tell you that 15 years ago, it was run, I'm trying to think of the company that ran it.
Life Point.
Yeah, LifePoint, and they just abandoned it. They just basically gave them, they had a lease, and they just told them, you got 6 months, we're out of here. And they literally abandoned them. And that was a time that when that happened, I actually was engaged to try to come over there to see what options we could make. The board of directors even met here at in the Palm Springs office to discuss it at that time and look at ways that they could. And so, there was, they did get some management organizations in there that did start to introduce like the IGT program and did some things that helped right the ship. But it was, even 15 years ago, it was in a very, very rocky state. I will say that the community has a very strong agricultural base, and there's I suspect some fairly wealthy agricultural companies there. But it's just, as you said, it is a very challenging thing. But the city doesn't have any money. It's a very poor community, and it's just been one struggle after another. But to directly answer your question, I don't think they've really done those kinds of studies.
They haven't. I mean,
They have or have not?
have not. I mean, in 2013, when I went to work for Congressman Lee, one of the first meetings we had was with the leadership of the hospital, not the district. And there was issues back then with the district. And I know for a fact that there hasn't been that kind of analysis. Even the farming industry, though, is not what it used to be.
Right.
It's all corporate pretty much now, and a lot of the land is fallowed because of the water issues that they dealt with. And so it's just, we're getting way in the weeds.
Yeah, but my understanding, the prison closed down, and that was a big.
Yeah, that's another.
That was something that hospital was.
Yeah, so the question that Chris asked of our attorney, I'm very interested in finding out the answer to that.
Yeah.
If we had an opportunity, if there was an opportunity, would we be able to enter into an agreement with the county for the application to be submitted to, and if it's even possible, if the dates are still, can we find out if we can do that and explore that as a possibility. That we could provide a loan to the county where they apply for it and we could get repaid that loan once they get the money.
And I think that the information that you mentioned or that you asked before, I believe Greg has told us that that information is available, like how many like life patients. and So that information is
From
available. and I
EMD
think
can
that
get that information
he's-
easily.
Said that before, so.
So can we, it is agendized, but not to that point. How far can we go to provide some direction, consensus to our,
Yeah, no, I think it's worthwhile to try to explore that and we'll
Yeah,
certainly,
I heard Jeff say that the district cannot provide loans.
well,
I said creatively, if there's a different way.
yeah, I mean, I use it as creative, okay? We're not, I mean, as you all know, we're not a bank, but there's agreements.
It's like a matching grant.
Are into, I think, particularly with the county, that if they're willing, and we need everybody to be cooperative. We need the county to be cooperative and open-minded. We certainly need to, but we also need to get the district over there to be receptive to this. And, that's a bit of a challenge because they're sort of in the bunker right now. And
This may be the thing that I would actually get them to say, there's something to gain by doing this. So if we could look into that to see whether there is still that opportunity to apply for the funding and being able to have the county, because I know the county has a lot of other things that they're dealing with, that are, but this is very important to them as well. And they've already demonstrated by being involved and dedicating resources, but they are looking also for alternatives, for solutions. So we could offer this.
Yeah, I mean, it's great, but somebody's gonna have to watch the hen house here, and it has to be coming from the county. And, they've had these, loans given to them, and then they just seem to squander the money or whatever doesn't, and so that's a concern, not so much that we couldn't work something out with the county, but somebody's gonna have to make sure.
Well, and the county's reluctant too to get involved as much.
Yeah.
So-
But they are also providing a lot of man hours, and those man hours are getting unpaid. So if there was a way that we could actually provide some funding that they would be able to cover some of those costs, that this might be something that they would be interested in doing.
Is there consensus from the board members to go ahead with, to do
To
that?
explore this
And I would say so, I
Explore
mean,
that?
this is something that I think we've been talking about since May, so it's already
Mhm.
6 months.
Yeah, exactly.
So I think that it's time.
Yeah, I think it's come to a point that this is something that has to be done.
And if I may, I mean, I think it's one of the things we need to look at here, like we do with all of our grant funding. We try to look at sustainability beyond the funding that we provide. And and we all want to provide as much care as we can to those residents of that area. But I think we also have to consider any kind of monies that go to this process are probably not going to be sustaining the hospital for the long term. The monies that are probably going to be utilized to keep the hospital in operation for a little while, but to me, it doesn't seem like there's the population base there any longer to sustain the operation of a hospital.
Not the way it is right now, but there has to be another model. And that's what the hospital, I think they need a little bit more time to be able to explore that and to consider other alternatives.
Yeah, like freestanding emergency department or rural hospital designation. There's a 24/7.
How far is the hospital from our border?
I'm sorry, Art.
How far is this hospital from?
It's about 100 miles from our hospital.
From the valley border of this district?
Oh, a good 80 miles probably.
30 miles?
80.
80 miles.
There's nothing.
What are the
Not much in
possibilities of
between.
putting a pop-up clinic on our border and harvesting the patients and giving them to Mike if they're hospital?
There's clinics out there.
What?
There are clinics
There
out
are
there.
clinics out there.
She's there.
Yeah, I mean, and if they're gonna, I mean, if you're gonna commute 80 miles to the board district border, it's not that much further to JFK. So,
Mhm.
Right.
Yeah,
And a lot of patients up there already come
to the
Yeah,
Coachella
exactly.
Valley for care.
Exactly.
And treatment. I mean, even for gynecologists and.
Are we done
specialties.
with this discussion? Should we let Chris move on?
Okay, thank you. The next item is item C, revisions to the monthly program committee schedule. So on our committee schedules, we have moved the monthly program committee to the second Wednesday of the month at 4 o'clock, which would be following our legislative committee meeting. So that's updated on our committee schedule. The next item, and please stop me if there's any comments or questions, otherwise I'll continue. Item D is the appointment of the district CEO to the ACHD Finance Committee. Just wanted to bring that to your attention that I'm not only on the board, but also on the Finance Committee for ACHD.
I just want to say thank you for making time in your busy schedule to do that. It's good to be represented in statewide association, so thank you.
Thank you. Item E is the CV link connecting the Coachella Valley grand opening celebrations. So CVAG has scheduled several grand opening type events across the valley. And those are coming up. There's a schedule in the packet that has those happening in the first couple of weeks of November. So if any of our directors, et cetera, like to attend those are they're there for your ability to do so. And I think it'd be good if we could support, especially since we've provided $10 million towards the effort to make sure that these CV links are in place. And I just have to make a personal comment. It's always, I find it interesting because coming out of my community, directly across the street, there's a CV link path there, but I constantly see bikers riding on the opposite side of the street, not on the bike path.
There's a lot of people that don't use it and they
Right.
continue to do the same.
I understand those that, where there's not such easy access, but when it's right on the other side of the street, I don't
Yeah.
comprehend that. But and then they weave in and out of the traffic lanes, and it's like, I don't like to see people killed, but boy, sometimes they're asking.
Well, that's the impetus.
Yeah,
CV link were all the deaths by bicycle riders.
right.
There's the purpose of it though. It's if you're gonna try to get from point A to point B, you're not gonna be using CV link, but its purpose is to encourage exercising and use of that. So
Absolutely.
hopefully during this time when it's starting to cool off, you'll see more. I started seeing more people using it. So
It's grown, yes.
I have too. It's just interesting to see those right across the streets if they're not using it. So,
And I am going to the Palm Springs.
Me too.
good.
going to the one in Coachella.
We got the
Okay.
one in Cathedral City,
Great, good.
Good.
the second part.
Yeah, especially in your zones, that'd be
I was gonna go to the one ranch.
wonderful.
Indian Wells.
Yeah.
So,
Okay.
all right, moving on to the next item, strategic planning. We have upcoming workshops on both Tuesday and Wednesday, November 18th and 19th. I believe those are scheduled for here. The first one is at 4:30 on the 18th and 4 p.m. on the 19th. So we definitely appreciate all directors being in person if at all possible. I think that's it's a better interaction, a better process for us as we engage with someone, that's working diligently with our process. And we are working towards establishing some more. We did the last time someone was in the area, we scheduled some one-on-one kinds of meetings with some of our community partners, grantees, et cetera. So we are working to schedule more of those activities while they're in town. Item G is Walker Company governance interviews. So we have Larry Walker, who is working with our board and staff to go through our governance process that we are engaging with Larry Walker. And so the first parts of that is complete completing interviews, one-on-one type interviews with Mr. Walker. And I know several of those have been completed, so we're close to finishing that process, and then we'll continue into some workshop type situations. Also, wasn't listed on the agenda, but we're doing the same with the DEI work that we're doing with Activate Inclusion. So there will be interviews that we'll be scheduling with directors and certain staff people as well. So just informational item for that. And then item H is the CEO engagements and district media visibility report. One of the items I wanted to highlight with that is Will has put together a catalog of the podcasts that he's been producing, along with links to those podcasts. And we're intending to promote and get these out in our social media and be able to kind of showcase these podcasts that Will has put a lot of work and effort into. I think they're great podcasts. And
They're really good.
yeah.
They are.
They're very good.
And also that goes hand in hand with what's on the consent agenda. There's a continuation of the consulting services agreement with Mutual Broadcasting to help support those efforts. And Will is excited to, at some point in the not too distant future, to be able to do some video podcasts as well as the audio. So, Will's got the smile. He's really excited about it. So
It's fun. I enjoy it.
yeah.
You do a good job at it. Like you engage with the other person really good, like it just flows. It doesn't look like there's
Appreciate it.
something awkward.
Mhm.
So if there's are there other comments or anything regarding those items?
Any other board comments? Any other community comments? Hearing none. Going to item number 4, annual holiday office closure.
Okay, so each year we request from the board opportunity for the office to be closed between the holidays of Christmas and New Year's. Seems like more and more organizations are closing their offices during those days and allowing opportunity for staff to enjoy with family, et cetera, who might be especially out of town, accommodating travels, and also for opportunity for R&R. But we will have our phone answering service. We will be monitoring that on a daily basis. So if there's any important, urgent kind of issues we need to respond to, we will take care of those. So we're asking approval from the board to allow office closure between the Christmas and New Year's holiday.
Does it take a motion?
And what is it?
Is that an action item?
It is an action.
Okay, we have a motion?
Wait, I think you got the question.
Motion and second?
There's not a motion yet. Hold on. So I'm kind of like, since Christmas Eve and Christmas Day is 2 days before the day that they want to close it, should we change the date to the 23rd after our board meeting? From the 23rd to the 1st? What do you?
Well, the reason it's being presented this way, I mean, the staff report does indicate that that we are closed for the holiday. Holiday days, these are the days that would not be the normal closure days. So that's why we're asking for, and you're right, to your point, the office would be closed from the 23rd through the 1st of January. I'm sorry, the 24th through the 1st of January, including the holidays on the front and back end of that. But this is asking for those additional days in between.
Let's see. Okay,
Okay.
make a motion.
I make a motion to approve.
Second.
Director Short seconded.
Second.
I think we don't need a roll call for that.
We
We should do a roll call for everything according to
Yeah,
our
we
legal
should.
counsel, yes.
Is there any public comments?
All right.
Public
Public
comment?
comment.
Is there public comment on this?
There are none.
Thank you. Roll call?
Director Shore,
Yes.
Director Fresco,
Yes.
Director Delara,
Yes.
Secretary Baraza had to leave us, Vice President Rodriguez.
Yes.
President Rogers.
Yes. All right.
Thank you.
Thank you. Appreciate that.
Thank you.
You guys deserve
All right.
Thank you. Next item is the annual holiday board and staff dinner. We come before the board to ask for approval of a board and staff dinner. We don't have, Andrea's working on a specific location. We do have tentative date for December 12th. And we're asking for a not to exceed amount of $6,500. Last year, we asked for $5,000. We ultimately spent around $3,000. We are looking at it at this year is that, you know, we do have a few more staff members. And if we're talking about potentially staff, board, and plus ones for everybody, plus the restaurant prices, I think as everybody has experienced, are becoming quite a bit more costly.
Inflation.
And not that we would be spending the $6,500, but we would like the flexibility depending on how many participants and we will be looking at similar price or similar because the last couple of years we went to what's it called? Enzo's, thank you. So we're looking at some other locations as well, but similar in their service and their prices. So we're asking for approval.
I'd move approval.
I second.
Sorry.
It's
Roll
okay.
call.
Public comment?
Oh, sorry. Thank you. Thank you, Letty. Public comment?
There is none.
Hearing none. Roll call?
Director Shore,
Yes.
Director Fresco,
Yes.
Director Delara,
Yes.
Vice President Rodriguez,
Yes.
President Rogers.
Yeah.
Thank you.
Okay. Jeff Scott, legal counsel?
Yes, so very briefly, as you may know, notwithstanding all the busy tweets our governor is sending these days, Senate Bill 707 related to the changes to the Brown Act were signed by the governor, was signed by the governor and will be effective July 1st. So we'll be updating, make sure these policies are updated and such for the district. Also SB 827 related to the expansion of ethics training for public officials, primarily related to financial stuff, which is, I think is a really good addition. That was also signed and the effective date of that will be January 1st. And we'll make sure we update this with the staff to make sure that your next schedule, you get this kind of training. So that's all I have to report tonight.
All right, thank you. Any public comment? And board comments? Moving on to sponsorship.
All right, so we have 3 sponsorships that we're presenting. And oh, by the way, I will go back to the policy that was approved on the consent calendar. There were some updates to the sponsorship policy that was approved by the board tonight that indicates that sponsorships over 5,000, those under 1,000, CEO still has some discretionary ability with, but anything over 5,000 and any other sponsorships under 5,000 that the CEO doesn't feel completely confident or that there's an alignment or a nexus with health and wellness, et cetera, our mission, et cetera, would like to continue to bring those for board consideration. But our process will be that any grants then will be coming to the program committee sponsorships. Thank you. Sponsorships will be coming to the program committee beginning November and will be considered by the board of the directors that are on the program committee. And that way they can be vetted at that level, determine a recommended amount that would be recommended to the board or recommended for decline if necessary. And that allows then the board members that, you know, have that fiduciary responsibility to be able to engage in vetting each of those and recommendation to the board. Additionally, we have added a couple of deadlines, application deadlines to this process, because I do anticipate that we're probably going to progressively receive more and more sponsorship requests. So to be able to better manage those instead of, you know, bringing each month, we would like to implement a semi-annual application deadline. So I don't have the deadlines in front of me, but if oh, thank you. I appreciate that. So for sponsorship events from July through December, we would do May 31st would be the application deadlines, and that way we can bring to the program committee and the board in June. And then likewise for those sponsorships, January, June, we would ask for in November so that we could come to December, the program committee and the board. Now this would be our general practice, and we want to promote this to the community. We will have updates, you know, our sponsorship program on our website, and it's going to take a little time and education, obviously, to educate the public. So we will address kind of in a transition period, you know, those that might have some time sensitive sponsorship requests, but as much as possible, we would like to stick to this schedule.
And so Chris, is this for sponsorships over $5,000?
Correct. And any sponsorship requests under 5,000 that the CEO feels that there should be board consideration. If they're straight up kinds of sponsorship requests that they're for healthcare related activities or events, anything under 5,000 could be then at the discretion of the CEO.
Any board comments?
I think these dates are good. They like good, but it would be starting. So this November, we would start the one for November, right?
Yeah, I think what we have to probably do for the next few months is probably address them as they come in. And then we would probably look at the May 31st as the date then that we would hold to any sponsorships July through December. We're going to have to be publicizing that you need to get those applications in before May 31st for us to consider. And obviously we'll address emergency kinds of asks, but we want to try to keep these down to, you know, kind of those two timeframes. Doesn't mean that we're going to reject them just because they're delayed, but you know, the public needs to be able to comply with these time schedules. I mean, cities and other organizations, they have, you know, application deadlines. So I don't think it's inappropriate for us to establish these.
And you will notify our current organizations that apply for sponsorships of the new policy?
Absolutely. There will be, you know, we'll do press release, we'll do social media, we'll have on our websites. So we'll get the message out, but it will, as far as the implementation of it, we've got to have a few months transition too. But I think it's appropriate to go with that May 31st deadline for January through December of next year applications.
Madam President, go ahead. Okay, so besides the dates, I'm happy with the rest of it as a whole. I think this is a good start for us to be able to manage future sponsors. And the only thing being is that I mentioned this at the committee that I anticipate that, like you said, there will be a lot more requests, and that is good because it gives us an opportunity to support these nonprofits that are serving our residents. But I just want to make sure that there's equity across the region to ensure that there's enough awareness, and that and as we do that, we have to think about the budget and what is realistic. But all of those things can be dealt with in the future when we start noticing that there is a potential problems that we need to tweak this, but this is a good start for us to be able to manage the sponsorships and to, for us to be able to allow this information to be shared throughout so that it's consistent, that everybody's hearing the same message. So I like it. Thank you.
And I think what's important, I'm sorry.
It's not an action item.
Oh, it's not?
Action.
No, it's just-
The sponsorship.
The sponsorship, it's, before we get into the
For the
sponsor
request.
itself, but
There's no action on these?
well, there is, but before we move on from the policy, I just wanted to make
Oh, okay.
one more comment, is that I think it's also important for us too, just like with grants and AB 2019, and Jeff, you can correct me. I believe it should follow the same principle, that we're not out soliciting sponsorship requests. If organizations come to us, come to board members, et cetera, we're going to promote, but I think it should follow the same lines, but you can correct me, Jeff, accordingly, if we can solicit sponsorship requests.
Well, I mean, I think, you want to have something on the website, you want to have something that's available so people can access it, and, basically through word through the community that these sponsorships are available to the district. But
I would just refer people to this policy.
Correct.
Or to the website. Yeah,
Yeah,
we should have the
The
policy.
website where this policy is included, because now there's actually guidelines.
Right. Yeah, and that's perfect. And my point was, I don't think that I should go to ABC organization and say, hey, district is doing sponsorships now, you need to apply for one.
I think through the website is sufficient.
So do we need to take action on these?
On each of these, but
Can we do them as a block? Yes. So
I move approval for the
Thank you.
three.
Wait,
1, 2, and
I
3.
have a question.
We could have a second. You can have your question. Is there a second?
I'll second.
Okay.
okay, so we have a motion and a second on all three, and now there's questions.
And Director Presgill has a question, and then we'll go to community comments.
Okay, let's do one.
yeah, absolutely.
Can't do
Go, move it
grants.
along. Yeah.
Who seconded the motion?
Great.
Great.
Director Rodriguez.
And Director Presgill has a comment?
No, my question was just, for the Desert Hot Springs site, for the Desert Hot Springs thing, because I had limited access to my computer. The sponsorship for that, is that for our, mobile unit to be out there, or what is that sponsorship? The Desert Nights on the Boulevard Arts Eats and Beats?
No, it's not intended for our medical units to be out there. It's their event that we would be sponsoring.
And I think the district is invited to have a table and participate.
Okay, so that's what it's for a table and to provide information to the community, or it's just for?
Yeah, it has ability for 3 dedicated social media spotlights and premium placement of personalized banner or advertisement on site at the event. So we can have some marketing opportunity there if we want.
Okay, I just had that question.
Go ahead.
Well, with that said, I think we do have to ensure that we do have banners that we can, when we have that opportunity, because that's the intent, is to bring greater awareness of the healthcare district. So if they're giving us that opportunity to have banners there, we should take advantage of that.
Right. And again, the amounts that are here are subject to the board if they want to change, et cetera. So that's up to you.
We have a motion and a second.
Do we have sufficient material for that, for promoting the district?
Yeah.
Yeah, we have a new order of merch, and we do have some standing banners as well.
Okay, so there's nothing else we would need increase in?
I don't think so.
Yeah.
I think we're good. What's the question?
Alejandro, did you have a comment?
Yeah, I just want to, bring, attention that to some of these sponsorship, when we do have a table, that there will be an opportunity that we will not use the table. We are a very small community engagement team, 2 of us. So we really have to be selective in which events we're gonna participate, have the medical mobile unit out there. I think this is a good opportunity for us to engage the community through our Connect IE program, you know, and that's part of the merch that we ordered was like the cell phone holders and things like that. So we'll be selective on some of the events that we participate in. But I know there's some, you know, other policies, you know, like our volunteer auxiliary that could potentially, you know, help us with, you know, some staffing at these events. But, you know, I think we just want to, you know, be cautious that we're a small community engagement, you know, we cannot be at all the events every week, you know, because it seems like we're getting a lot of sponsorships lately that offer us a table, but we have to be selective on.
Yeah, and I get that. I agree though with Director Lara though. It's just, even just the visibility aspect is important.
Yeah, as much as
I've traveled a lot of events and it's not always the most useful thing to do.
Of time, right.
So whenever we're able to, I mean, like I say, there's some crossover kind of things that might be challenging to do, but as much as we can, we will have those available.
Dare I bring up the ticket policy, but it gives the ticket master or the person, this is one of the hats that Chris wears, is to, if it doesn't look like you'll be able to fill the table, there may be other people in the community or other people that you can contact that would be interested in coming. So,
Yeah, if there's a table associated, we try to fill it first with our directors, and then if there's staff that's interested, if we're unavailable, we contact the organization and allow them to, you know, provide those seats to others. So we've done that, like with the School of Medicine in Riverside, where we've sponsored table. We haven't all been able to go, but then we offer those to some of the students to go in place.
Okay.
Alejandro had a question, sorry.
However, we will make exceptions for golf tournament, sponsorships.
Okay, are there any public comments? Hearing none, roll call.
Director Shore.
Yes.
Director Presfield.
Yes.
Director Delara.
Yes.
Vice President Rodriguez.
Yes.
President Rogers.
Yes. Okay, committee meetings, committee reports. Legislative Policy Committee did not meet in October. Program Committee.
We met and all the information is in the packet. If anyone has any questions regarding what we went over. We did for the grant. We have to discuss the regional.
I'm gonna recuse
Grant number
myself at
50.
this time.
You may recuse yourself.
Thank you.
Let the record show that Director Delara recused herself. Discussion
We
on,
don't have a forum.
is there, yeah, well, there's four.
Oh, four.
Can you give us a brief overview,
Yes.
Donna, please?
Yes, we had a grant application that we received from Regional Access Project Foundation for $200,000 to cover 2 years. The first year was to cover the reduction of the grant from the monies from the county. This is their healthy living, active living.
Donna, could you hold up the microphone, please? Thank you.
Anyway, this was a grant that was submitted by Regional Access Project Foundation for $200,000 for 2 years. It is to cover funding the first year that the county pulled back due to lack of the federal funding being cut. We brought this forward to program committee because this is not a high priority goal. This is under high priority goals, of course, are 2, 3, and 6. This is not part of the high priority, so as part of the district's approved grant process, approval process, when a grant is not under is a low priority goal, that we bring it to the program committee and ask the program committee for direction, whether or not to continue with due diligence and move it forward to the board, or just to decline it. And we did add one other component to it that staff reviewed it, and we were bringing forward that we would we would recommend that we fund the first year. So there's those three things down here. You can see it highlighted. So, but the program committee also moved approval for staff to continue due diligence and bring it to the board to continue the due diligence for the 200,000 for 2 years. There are representatives from RAP here, if you have any questions.
I would move for staff to continue the due diligence.
To do what? I'm sorry?
To do the due diligence.
I'll second that. Any discussion? Any community comments?
Yeah, if I might just briefly. So just to make it kind of.
Introduce yourself, please.
So my name is George Holliday. My name is George Holliday. I am the controller for Regional Access Project Foundation, and I've been actually put in charge of presenting this grant to the healthcare district. And so one of the things I kind of wanted to point out, the funds that we were asking for, like Donna said, is to offset those funds that we lost from the county because those were originally federal dollars that the federal government has recently pulled back in some of their changes and some of their executive orders. And to show you how important this program is to us to continue, we've been doing this program where we've been doing the education in the schools, especially in the east end of the valley and some also in the west. The Regional Access Project, we've committed $125,000 of our reserve funds to make sure that this project continues going forward. Basically 125 over the next, or 125,000 each year for the next 2 years to offset what's being lost from the county, because it's almost a $300,000 budget that we were getting from the county. So we're setting those funds aside. We did this current year. We've got almost 100,000 that was left over from the county. They were able to get out to us before the 9/30 deadline. And this extra 100,000 a year will allow us to continue for the next 2 years to be able to provide education for nutrition and health for the school districts. And I'm happy to answer any questions.
What would due diligence entail in this context?
Hold on. Yeah, go ahead. Right.
Well, I'm sorry.
No, it's because I was gonna ask, because at the program committee meeting, you're currently just doing it at Coachella Unified School District, right?
Well, we also have education classes we're doing in Desert Hot Springs and Palm Springs Unified School District as well. And Adam, I'm not sure which schools there are. You'd have to remind me.
There's 3, Bella Vista Elementary, Julius Corsini, and Paddock Garrison.
So yes, and currently I think we're about the only organization that's still carrying forward with this project since the county lost the funding. The other organizations have actually dropped. So there is still a need out there because some of the other schools and school districts have started reaching out to us because they know that we're still doing the program. And we are looking at those to assess if we can help any of them at all, because some of them have already committed time and money to those programs. But we're kind of limited staff, so we want to focus on the schools that we've committed to last year first before we move on to adding additional schools unless we can find additional funding.
So as of right now, you don't have any nutritional classes planned or in the works or talking to from the Desert Unified School District, right? I mean, Desert Sense.
I don't think so. They were under a different organization. I believe they weren't, because they had us divided up into organizations and they didn't allow us to overlap into other districts. We were assigned specific locations that we were allowed to, and so, but those organizations, those schools that are in those districts have been reaching out to us and saying, can you pick up our program? Unfortunately, we aren't able to do that right at the moment. We're focusing on keeping the programs that we do have in place right now because we've made commitments to 8 schools in the Coachella Valley School District, and then the 3 that are in the Palm Springs School District.
So George, that would technically then end after years. So if we do our due diligence and and it comes back where it is the 2 years to 200,000, then that second year for 100,000, you can open it up to other schools, correct? Because technically with the county and what the restrictions they put on you would end after one.
Well, actually, the restrictions ended as September 30th this year because that contract ended and we had signed originally a contract for a year, but they said there'd be no more funding after September 30th from them. So as of September
You could
30th.
add more schools?
Yeah, so we can add more schools as we get the funding and as we add additional staff. But currently we're limited. We have a staff of 3 right now that's doing these 11 schools. We are looking for additional funding for other resources. I know we're looking at the agriculture. There's several agricultural grant programs that are out there. This first 5, I think, where we're looking at also possibly for funding. So there's different other programs that we're looking at to help supplement what we're putting in as RAP Foundation, plus what hopefully we're going to get from the healthcare district. Because we really think this is a program that we could grow and expand. Before we were limited by the county on the areas we could go into, but now we can expand as we get additional funding. But currently we want to make sure we get our organizations met for this year that we've already committed to for the next year. And then in the second year, we can look at expanding as we get additional funding.
Okay, I'm just looking at it because everything that we do and we say we want it to be equitably distributed through the community, right? And so if we're only helping 2 districts, what's going on with the one in the middle? That's why I was asking about if they've already gotten talks with Desert Sands Unified School District or whatever.
Any more comments from the board?
Greg, when you asked for, when you recommended due diligence, what does that entail?
I think staff needs more time to address how this fits in.
Yeah, so-
And then also I'll just piggyback off of what Yvette said is that exactly part of the due diligence is how can they assist the other district in the middle?
Exactly. So the due diligence is the process that we do internally with staff where we vet the entire grant application. And so that hasn't been done at this point and the reason it hasn't is because the grant, the idea of the grant is not part of our 3 high priority strategic goals. So if we see a grant that comes in that's not part of those strategic goals, then we bring to the board, to the program committee, then the board, to ask if this is a grant that the board members would like us to complete that due diligence process. Because we do a whole lot of additional work before we actually bring a grant.
Right, exactly.
So, and with that, I think from what we're hearing, my belief is our due diligence process will be asking RAP to consider including what they would need to include all 3 school districts. So I think that will be part of that due diligence process and what, sounds like capacity issues and things like that. So if we're going to support the program, which I ultimately think we will, I think it would be beneficial if we're able to have all 3 school districts.
I don't have a problem. Like my thing is not I know it's a great program and it's needed in the schools, but for the same reason, I feel that it's also needed in the Desert Sands Unified School District, and we do always say equitably contribute to our community. So if that could be something for myself, if that could be something that you guys could talk about or whatever about adding Desert Sands Unified School District, I would appreciate it.
Which department in the county was it being funded from? Public
Gail
health?
Hoxter,
What's that?
Gail Hoxter's department, public health.
Public health.
I will say we're not opposed to doing all of the districts if we can. It's just a matter of finding the resources to do it. And we would love to, because like I said, we've had other schools calling us and saying, can you help us out with this? We have commitments. And if we can find the funding, we're more than happy to figure out a way to help them. So that's, it's just, we're trying to figure out, it's not a new program for us. I mean, we've had it for a couple of years now, but it's changed dramatically. And that's one of the things that we have talked about is that we can actually mold this program to what we want it to be, which would allow us to do all of the school districts at some point.
Because before, like I said, we were under county restrictions, which said each organization has their own set of schools that they're dealing with. And so, you know, we're not allowed to cross over to another area, but we can actually do that now. But our key focus right now is finding funding to continue that program and expand it.
Okay, and we brought this forward to program committee, but for those of you who are on program committee, the Desert Healthcare District also had this program years ago with it's called NEOP then, Nutritional Education and something. That's how Alejandro came on board because then we combined it with Ready Set Swim. So, yeah, we had a contract.
How big is the survey for?
You remember that? Yeah.
Great.
Program.
Okay, thank you so much. Any other comments from the community? The board is to give direction to staff. It's not an action item.
I think we're just giving you direction, right?
Yeah, giving us direction to proceed.
You have direction to proceed. Yes, 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 yes. Okay.
Call Letty real
Yeah,
quick.
call Letty back in. Finance committee?
Nothing
Looks
of
like you're the only
consequence
one here. Yes,
other than the draft meeting minutes.
got it. Thank you. And board and staff communication and policies committee. You have a draft meeting minutes.
Do we want to invite Director Delara back?
Yeah, she's
Yes,
invited
yes,
back.
Good.
Great. We're discussing board and staff communication and policies committee. You have the draft meeting minutes. You have an informational item on 4B for a volunteer auxiliary. That's just informational. It was presented to staff to come back with a policy that would be instrumental for us to consider. And then we have 4C, which is an action item, but discusses elections and appointments. Did you want to bring that up, Andrea, please, for discussion?
And just an overview on this item.
We're gonna have.
A few years back, there was
I'm sorry.
Oh, no, you're fine. I just didn't know if you guys want to.
Sorry, I wasn't sure if we were gonna discuss here number B, part B.
Okay, yeah, no, and that was just a direction from the committee to come back with a draft policy to consider. And so item C is the BOD2 elections and appointments. So about 5 years ago, the board went through an extensive process of identifying how to each year when we do the annual election/appointment of the officers for the year. And so it was proposed this year that we revisit and see, consider other options in how the board officers are identified each year. So we ultimately had presented two different policies. They're all related to rotation. And one of the policies was rotation by zone number. And that would be, we initially talked about maybe zones 1 through 7 and then go through a rotation process through when once, one is served as president, then they rotate to the bottom and then cycles through that process. Recycle isn't probably a good word, but, or cycle, rotate through that process. Thank you. And so then it was also suggested by, I think, Director Delara to consider a seniority rotation as well. So directors with the highest seniority then would start at the top of that rotation cycle. So we do have in the packet then both versions. The committee did recommend by a 2-to-1 vote to forward to the board for consideration of the seniority rotation.
And this would take effect November.
In December. So December is when we have the new officers. So whatever ultimately is approved would then be in effect for the December officer
notwithstanding which proposal you make, was any consideration given to the board member who elects not to sit for an office?
Yeah, so we do have language in there that says if a director is eligible for the rotation into a certain office seat, they can opt out, and then they would rotate down to the bottom and go through the cycle again, or the rotation.
Thank you.
Any more discussion? Okay.
I'm really pleased that we could do this, and hopefully we will be able to pass this so that we have a better understanding of the process and that we know what to expect, instead of, having uncertainty. And I did mention that, that in consideration of the fact that we have, if we were to adopt this, that the next person that would be serving would be Director Barraza. And after that, it would be myself. And I did say, and I stand by this, that I would opt out to ensure that the next person after me after Director Barraza would be Director Rodriguez to serve after her. I believe that that's fair because you have not had an opportunity to serve. So that would be my plan.
And what about me?
Oh, well, I can only speak for myself.
Consider sure.
I support Mr. Rodriguez undeniably, without reservation.
That's right. I did mention you that you would be asked and you would have the opportunity.
Right, thank you.
Right. And Mr. Rodriguez, Director Rodriguez.
Okay, so this is actually the seniority schedule here. So it would flow by that depending on, I think, the idea would be, since Director Rogers has been president, that even though she has the highest seniority, that she would not be eligible for president next year. Now, I think Director Perez-Gil could be eligible. And then Director Shore, and then Director Delara, and then Director Barraza, and then probably what we'd have to do when we get to Director Logston and Director Rodriguez in the process is I'd recommended like a draw of straws. So, some way that's, unbiased, but, identifies a sequence, but that's the seniority listing that we have presently.
Well, I was gonna ask Director Rodriguez as Vice President, this is ostensibly, as Vice President, you were to take over in December. Are you okay?
I'm okay with this process, because I think it just means certainty. I'm also not one that when the committee makes a decision by a majority to go against that. That's just my personal thing. So I'm fine with this. I think too, as again, to Director Delara's point, I don't think every time somebody's going to want to take a leadership position.
It's a lot of work.
So I'm good with this. Again, my biggest thing is when this goes to committee, I mean, unless it's a really controversial thing, is I don't like to overrule a committee's decision.
Chris, I thought that we had included some words in there that said that if a board member has, to give everybody an opportunity to serve. I thought we actually had with the order that it would be Director Shore first, and then Director Barraza, and then that I didn't know that we had included the other order of people that already served. So did something change after that discussion?
Well, there isn't anything that specifically says in the policy that, like, say, for example, Director Perez-Gil couldn't serve as president because there's been, a year lapse with that. I don't think we have anything in
I thought we actually had some language in there saying that if you've already served and not everybody else has served, that it was kind of positioned, but we didn't.
I don't think we have that.
Okay,
because I don't think that would make sense.
Previous statements.
Yeah.
So.
Because
not-
we-
This. So
We-
to me, it would be Director Perez Gill, then Director Shore, and again, anybody along the lines here can opt out. And that specific language is in there.
Yes.
And then obviously would come to Director Delara, and then Director Barraza in that process.
My point was that, and due to the fact that we have a vice president, that we could delay this 1 year and have Director Rodriguez serve as president, but also knowing what the responsibilities are, I know that we could look at that, but you're okay with,
I am.
okay, all right, good. So is there more discussion?
And to that point, if it were postponed, which that's the board's decision, it would remain as the current policy that we have with the election process.
Yeah, it sounds like everybody's in concurrence with this process. Is there any public comment? Do I have a motion to approve the policy?
So moved.
Is there a second?
Second.
Okay. Roll call, please.
Is there any public comment?
I asked.
Oh, I'm sorry, forgive me.
I've had a,
Director Shore,
Yes.
Director Perez Hill,
Yes.
Director Delara,
Yes.
Vice President Rodriguez.
Yes.
President Rogers.
yeah,
Okay, so that will be effective then for the December board meeting for election of officers. So
well, do we have election of officers at the November board meeting?
no, December.
Oh, I was hoping.
Hold on.
We do it in December so that, in years of election, then we have those directors seated if we have any new directors
Okay.
coming into play.
Okay, board member comments. There's only one that is listed, and that is something that I included in the staff report, maybe not. I was invited to attend California State University San Bernardino Palm Desert campus dedication to the profession of nursing ceremony. And it was very touching in that there were 20 new freshman nurses that going into the program. And I think each one of them had 4 or 5 family members of several generations and babies attending. It was really great. And they had a very moving ceremony with a video about the profession of nursing. So I enjoyed being there as your representative. Are there any other comments?
2-1 Toronto.
No.
You can adjourn the meeting and then we'll.
Okay, meeting's adjourned.
It's adjourned.
6 o'clock. Can we have a 5-minute break?
5-minute break.
Second.
Minute break.
He's
We have to bid.
Okay. Foundation,
That's already rolling.
I call the foundation meeting to order.